An absolutely tragic trend that we are witnessing. Let's take a look now at some of the players who have been affected in the past. 30-year-old Cheick Tiote is the latest to pass on while on the pitch last week while playing for his club Beijing Enterprises. In April, Ivorian-born Gabonese international Moise Brou Apanga died while training with his club in Libreville. Notably, Patrick Ekeng collapsed and died on the pitch while playing for Dinamo Bucharest at the age of 26 last year. In 2015, Nigerian David Oniya passed on while featuring for a friendly for his club side in Malaysia, while 2 years earlier, Sekou Camara passed on in Malaysia. The Malian was just 28 years old. At just the age of 21, Chinonso Ihele-were died while playing for his Romanian club in 2012. Zambian Chaswe Nsofwa was a striker with Hapoel Be-er Sheva, who died while training in 2007. The sad case, of course, of Marc Vivien Foe shook the world in 2003 at the Confederations Cup, and one of the earlier cases happened back in 1989 when Samwel Okwa-waraji died during a Super Eagles match in Lagos. Right, to give us more insight into this, I'm now joined by Dr. Philippe Gradidge. He is a senior lecturer at the University of Witwatersrand in South Africa. He studied, among other things, biokinetics and exercise science in the university's Center of Exercise Science and Sports Medicine. Doctor, this is a worrying trend we've been seeing. Active football players are dying on the pitch. What seems to be the problem? Of course, these players being having regular exercises, being in tip-top shape.
Good evening, team, and it is correct. So incidences of sudden cardiac death are always tragic, especially with the younger African players, because they do affect us and we mourn in those cases. Previously, it was mentioned around access to good medical care in Africa, which is very important. So primarily ECG should be done, and they're not being done throughout Africa in amateur players as well as professional players. And so we know from evidence that many of these cases could have been prevented if the medical teams had included some kind of pre-participation screening beforehand, and to continue with this type of screening on an ongoing basis.
All right. Now, Doctor, what signs should we be looking for, or should clubs and national teams be looking out for, especially the experts, to take quick action in the event that a player does, for example, collapse on the pitch?
Okay, so before the player collapses, if he or she experiences sudden cardiac arrest, so that is a clear sign that this player is at risk of sudden cardiac death, future sudden cardiac death, and every collapse on field should be treated as an emergency. Also, if the player experiences unexplained fatigue, unexplained dizziness or chest pain, also clear signs that the player should be treated as a potential at-risk player for sudden cardiac death.
And finally, Dr. Gradidge, obviously we've been talking about football. This is something where we've seen a lot of footballers collapsing on the pitch. But talking about risk, is there a particular sport that can be said is more dangerous and which is probably more safer?
So your endurance sports are seen to be safer. Soccer is seen as an intermittent type sport. So it does depend. So there could be certain triggers. For example, if your player has pre-existing or underlying cardiac abnormalities or cardiac issues, an illness, for example, could put that player at risk if he continues to play while sick with the flu, for example, or if the player has experienced before and has experienced sudden cardiac arrest and decides to ignore it and continue to play, that player and the medical team are putting the team at risk and putting the player at risk. So coming back to your question, I'd say that endurance sports put less stress on an athlete in comparison to football.
All right, Doctor, thank you very much for that insight. Dr. Philippe Gradidge joining us live there from Johannesburg. He is a senior lecturer at the University of Witwatersrand.